Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Today we're talking about who can be eligible for both Medicare and Medicaid at the same time, a status often referred to as being dual eligible. This is an important topic because having both can lead to very comprehensive health coverage with little to no out-of-pocket costs. Let's break down how someone can qualify for both of these distinct programs. First, you have to understand each one separately. Medicare is a federal health insurance program. Most people qualify for Medicare by turning 65, as long as they are a U.S. citizen or have been a legal resident for at least 5 years. You can also get Medicare if you're under 65 but have a qualifying disability. This usually means you've been receiving Social Security Disability Insurance, SSDI, benefits for 24 months. There are also special cases where you can get Medicare right away, such as if you have End-Stage Renal Disease or ALS, also known as Lou Gehrig's disease. So, the key to Medicare eligibility is typically age or a qualifying disability. Now, let's look at Medicaid. Medicaid is a joint federal and state program, and this is a crucial difference because eligibility rules can change a lot depending on which state you live in. Unlike Medicare, Medicaid is primarily based on your financial situation, meaning your income and your assets, like money in a savings account. It's designed to help low-income individuals and families, including children, pregnant women, adults, seniors, and people with disabilities. Each state sets its own financial limits, often based on the federal poverty level. To find out if you qualify, you must check the specific income and asset rules for your state's Medicaid agency. So, how does someone become eligible for both? A person is considered dual eligible when they meet the criteria for Medicare and the criteria for their state's Medicaid program. For example, think of a 75-year-old woman. She qualifies for Medicare because of her age. If her only income is a small Social Security check and she has very little savings, she would likely also meet her state's low-income and low-asset requirements for Medicaid. Another example is a 50-year-old man who has been on disability for several years. He qualifies for Medicare because of his disability. If his disability income is low enough to fall under his state's Medicaid threshold, he too would be dual eligible. When you have both, Medicare pays first for your healthcare, and Medicaid then picks up most of the remaining costs. Medicaid can help pay for things like your Medicare premiums, deductibles, and co-payments. It can also cover important services that Medicare doesn't, like long-term care in a nursing home. Thank you so much for watching this video. We hope this breakdown helps you understand who qualifies for both Medicare and Medicaid. If you found this information valuable, please consider subscribing to our channel for more straightforward explanations of important topics.